Hey y'all, Azim here. We are going to talk about the thoracic cage. So that includes the sternum and the ribs, and I guess they're supported also by the vertebrae posteriorly. We're going to focus on the sternum and the ribs. So first we have here the sternum. The sternum is this central medial bone, center of your chest, protecting your heart and your lungs. That's one of the main functions of the thoracic cage. The sternum is divided into three parts. It used to be three bones early in development, but it fused together like a lot of other bones that we've seen, including the frontal bone and the mandible, and we'll see the coxal bone and sacrum and coccyx. So, three parts. First part here, that is the manubrium. You can even feel it on your own body. The manubrium, you've got this little notch right here. That's called the jugular notch. You've got these little notches here. Those are called clavicular notches because they articulate with the clavicle. And then you've got a joint between the manubrium and the body of the sternum. If you look carefully, you'll see this slight bend from the manubrium to the body. So this is called the sternal angle. Once again, here's the manubrium, jugular notch, clavicular notches, sternal angle at this joint between the manubrium and the body. You can see that the manubrium does have an articulation with the first rib and partially the second rib. Most of the ribs have articulations with the body. And so here are these facets, these costal facets for the ribs, really the rib cartilage, costal cartilage. This last part of the last part of the sternum does not articulate with the ribs. This is called the xiphoid process, xiphoid, xiphoid process. It does not articulate with the ribs. This definition right here, from the costal cartilage to the sternum and down, this is called the costal margin. Your diaphragm kind of follows this path. At rest, your diaphragm is curved like this, and then when it flattens out, when your diaphragm contracts, that's how you breathe in because of changes in pressure in your thoracic cavity. Your ribs, there are 12 of them. We can count them. It's easier actually to count from the back because we can see all the ribs, including the false and floating ones, which we'll define in a second. So here is our first rib. It is the shortest rib, curves a lot, and it articulates with the manubrium. This is what it looks like. Very short, kind of broad and curved. That's rib number one. And rib one is special because its joint with the manubrium is called a synchondrosis, meaning it's bone, cartilage, bone. How that differs from the rest of these, it's bone, cartilage, synovial joint, bone. These are synovial joints. This is a synchondrosis. Rib 1 is special, meaning it doesn't move as much. It's an amphiarthrosis. It doesn't move at all. It's a synarthrosis. So that is rib 1 up here. And so here's our first thoracic vertebra, rib 1, rib 2, 3, 4, 5, 6, 7. These first 7 ribs, if you'll notice, one, two, three, four, five, six, 7. These first 7 ribs have their own costal cartilage leading to the sternum. Because they have their own, they're called true ribs. The first 7 ribs are called true ribs. True just meaning that they have their own costal cartilage. Now you'll notice that there's a few more here. Let's count it again. Rib 1, 2, 3, 4, 5, 6, 7. Ribs 8, 9, and 10. 8, 9, and 10 are false ribs. as I trace them along, you'll notice that they also have a cartilage. 8, 9, and 10. They also have a cartilage, but they share a single cartilage. These all branch together toward the sternum. 8, 9, and 10, because they have a shared cartilage, they're called false ribs. So they're not false because they're not ribs. They are ribs. They're just false because they don't have their own cartilage. I probably would have called it something else, but that's just what they're called. So 8, 9, and 10 are false ribs. The last two ribs, here and here, 11 and 12, they're also technically classified as false ribs, but they have an additional classification. What you'll notice is that if you follow the bone, there is no cartilage. It does not connect anteriorly. It does connect with the vertebrae, with the thoracic vertebrae, but it does not connect anteriorly to the sternum. Because they don't connect anteriorly, they're given another name that doesn't make complete sense, but kind of does, not really. They're called floating ribs. I just want a disclaimer, the true only floating bone we have in our body is the hyoid, because the hyoid doesn't actually articulate with anything. It's shown attached here because you can't have a bone floating around. It needs to be attached when you have a model. There's no tendons and ligaments here. But these ribs are attached to these thoracic vertebrae. They're just not attached to the sternum, but they're still called floating. So 11 and 12, they are false ribs, but they're also floating ribs. There's no attachment to the anterior side. Just so you can see the difference between the different ribs, this is the first rib. This is somewhere in the middle. This is rib number, I swear it's written here somewhere, rib number 7. So rib 1, rib 7, and rib 12. You'll notice that rib 1 is flat, very curved, and short. Rib 7, very wide, big curvature. Pretty big. Last rib gets short again, but you'll notice the difference. It doesn't curve as much. So you'll see this progression in the ribs as we go from small ribs, bigger, 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 smaller, 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 with less curvature in the back. So you can see how the ribs connect to the thoracic vertebrae. Here's a thoracic vertebra. Here's the body, spinous process, transverse processes. Since we are on a thoracic vertebra, we can see costal facets on either side of the body. A superior costal facet and an inferior costal facet. On the rib, you have your costal end, which is pretty flat. The costal end is pretty flat. And it's pretty smooth on this end as well. If you'll go on this side of the rib, though, you'll notice that it curves more, and there's some texture here. You've got a bump here. This bump is known as a tubercle, a costal tubercle, and you've got a head and a neck. This head and tubercle, they articulate with the costal facets and the transverse process of the thoracic vertebra, and it fits in nicely like that. So this would be the anterior side, protecting the lungs right here. This is the posterior side, attached to the vertebra. You can see here's that tubercle articulating with the transverse process, and the head and neck are deeper in, articulating with those costal facets.